Yeah, thank you, Sarah. So as Sarah said, this is going to be on the white coat. We're going to go through the history, some data, some physician perspectives locally, and then finally we'll think about your own answer. Um, this presentation is brought to you by my mother's urging that I wear a white coat. It started essentially as soon as I became a doctor. And so thank you, Mom, for that and your constant support and pushing me to be the physician I want to be. Um, in terms of disclosures, I just want to say that my presentation does have kind of an American focus and a Eurocentric bias. And I do not cover kind of many other histories, but there are so many other histories out there. I just want to say that. And then I just want to thank all of the folks who were able to email me back with their own thoughts about the white coat. And then also Renata and Alan, who I've been able to share my own thoughts about this presentation, and were able to give me some guidance. To start, I just want to kind of give a minute or two to ponder, do you wear a white coat? Why or why not? To kind of help frame this presentation. If folks want to, throw in the chat, yes, no, or, here's why I don't, that's totally fine, but also fine, just keep it to yourself. But we'll start with that. A lot of no's. Interesting.
Did you say we could also speak?
Yeah, totally.
I'll say the rare times that I do wear a white coat, it's usually when I'm trying to show solidarity with other folks in my team who want to wear their white coats to, I think, try to set or define their role as physicians within the team. Um, and it's always, the idea that if we're all wearing something different when we come in as a team of doctors, maybe that's why people are misrepresented for different healthcare professions roles. And so the handful of times I've worn it, it's usually been because I've talked with either senior or junior members on my team and wanted to support them.
Yeah. Yeah, that's awesome. I think other folks would have similar sentiments and maybe actually come down on a different answer in regards to thinking about their team. So I think all of that to say that there's a lot of different perspectives on that, and we'll get into some of those eventually, but thank you. So in terms of learning objectives, by the end of this session, I'm hoping that you can be able to tell, a simple version of the history of the white coat. Name 3 findings from recent white coat studies, identify 5, broad reasons why physicians may or may not decide to wear a white coat, and then consider or reconsider your own choice. It seemed like a lot of folks had reasons not to, and so maybe consider some reasons too, or fortify your own reasoning. We'll start with a little trivia. Does anybody know who this gentleman is on the left? Or want to take a guess? Osler, great. Okay. I will give you the hint that the beverages to the right of him allow them, or he's the reason that our beverages to the right of him last much longer or have longer shelf lives. Yes, Sharmila, that is correct. This is Louis Pasteur. So he's a French scientist. Some call him the father of microbiology. And while working in France in the middle 1800s, he had a number of experiments aimed at disproving the spontaneous generation theory of life. Examples of the experiments would be that he'd take some broth, put it in a flask, heat up the broth, and then seal the container versus taking the broth, heating it up, and leaving it open to air. He found that the ones that were sealed did not have any contamination and did not grow anything. And the ones that were open to air kind of became putrid, and ultimately thought that, it's not that there's spontaneous generation of life, it's that the air actually has dust particles, and that is how life gets into our like science experiments. And then he's also the one who came up with the process that we know as pasteurization, and patented that for wine in 1865. He publishes a number of studies kind of pointing to this life force, but that doesn't necessarily translate over to medicine. And so ultimately, this is Joseph Lister. He's a British surgeon and teacher, and he is considered by many the father of modern surgery, because he translated some of the principles that Louis Pasteur had developed, and put them into the surgical realm. He kind of at the beginning accepted Louis Pasteur's theories, and thought that post-operative infections were because of these contamination, essentially, from microorganisms, and that if we could keep kind of our surgical wounds clean, we would have fewer complications and be able to save a lot of patients. This molecule on the right is, at least back in the day, was called creosote, but is now called phenol or hydroxybenzene. But he eventually, kind of tampering with this molecule, created a number of products aimed at keeping wounds clean, and ultimately created kind of like a liquid form that he would soak some lint in and place over wounds. And despite the aspect that it's actually like pretty harmful to the skin, it did really help his patients, and he had some pretty outstanding or astounding results. I think around that time, numbers like over 50% of patients were dying because of post-operative infection, and so he really limited that number. And yeah. Second trivia question of the day. There's a hygiene product and a bug that are named after this surgeon. Any guesses? Oh, Jason already. Sorry, I am late on the chat. But also Listeria, yeah. So Listerine actually is not created by Joseph Lister. It was created by somebody else, but gave props to Joseph Lister for his work in the field of antisepsis, and yeah, also Listeria is the bug. I'm going to move into so Joseph Lister has this idea, again, similar to Louis Pasteur. Not everybody accepts it. Many people scoff at this idea, including the surgeon that we will see in this painting. Does anything catch your eye in this painting? Yeah, totally. Yeah. Um, yeah, I think these are actually physicians who are retracting, but yes. The med students are all in the background. And who's to say if they might have gone to to um dinner afterwards. I don't know. Yeah, Becca, you had mentioned family member. It's possible. No, Thomas Eakins actually left no notes about this person, but many folks have speculated that this might be a family member. Yeah. So this is the Gross Clinic that was painted by Thomas Eakins in 1875. Many of you have, already called out. Sorry, so Samuel Gross is the surgeon here in the kind of prominently in the foreground here. And he was a surgeon who practiced at Jefferson College, and this painting was commissioned by Jefferson College as he was retiring. And this kind of depicts a picture of what surgery looked like in 1875. And in the background, you can see a bunch of medical students because he is also a teacher here. Many folks have pointed out, no gloves, no masks, black coats. This is, there's no suggestion of sterilized equipment. It's all a little messier and less sterile than we would expect in today's day and age. Yeah, I think the scrub techs would probably faint if they saw this. Just want to say that it was said by Samuel Gross, the surgeon here, that little, if any, faith is placed by any enlightened or experienced surgeon on this side of the Atlantic in the so-called carbolic acid treatment of Professor Lister. So he had not kind of subscribed to the theories of Joseph Lister and Louis Pasteur. And black coats were the attire of the time. Part of this was in the fact that physicians really had such poor results that they, representations of death and dealing with death was not uncommon for physicians, and patients would kind of use doctors as a last resort. And so they kind of had their dress to be close to that of clergymen. And that was kind of the attire of the time. We're going to use a similar painting from 14 years later in 1889. And I should say that this painting is actually at the Philadelphia Museum of Art, as is the next painting that we will see. But kind of same question, potentially can contrast even a little bit more with the previous photo if there's anything that you notice here. Yeah. Yes, we've got folks sleeping. One might say not everything has changed from back in the day to now. So yeah. Okay, so yeah, dress has completely changed in 14 years. So this is the Agnew Clinic, again painted by Thomas Eakins in 1889. This is David Agnew, who was a surgeon teacher at the University of Pennsylvania, and similar to the last painting, this was commissioned by his students as he was retiring. But you can see very clearly that there has been a change in the dress code, in that all of the folks in the operation are wearing kind of white coats, and looking at kind of the instruments, you can actually see it's encased, and all of these have been sterilized. To Jason's question of, there still are no gloves, I think it was the year later that gloves actually come out, due to the fact that some of the treatments or solutions to prevent infection are found to be caustic to folks' hands, and so people start wearing gloves in 1890. Kalani pointed out that folks are still sleeping, and that is certainly an interesting kind of commentary on the medical school training. But yes, many of the kind of uniforms that physicians are now wearing have changed, and white is now to represent sterility and cleanliness, and we kind of are stealing from the lab coats from basic scientists to steal some of their their credibility, the amazing work that they're doing, trying to kind of rub off some of that. We are modern day physicians. We are not antiquated or old in our treatments. Yeah. In the same year, 1889, the University of Chicago has its first white coat ceremony. And the story goes that a professor at the medical school was complaining to the dean of medical education that the first year students were, quote, showing up in shorts and baseball caps to sessions where patients are pouring their hearts out. And so the dean of the medical school thought of the solution to have this white coat ceremony where families were invited, students were given physician coats, and told, for any session where we have patients present, we expect you to look like professionals, wear the white coat, and behave appropriately. Having known a few med students, graduates from the University of Chicago, I think we can see why the tradition has continued. A few years later, in 1993, Columbia hosts their first white coat ceremony and add in the Hippocratic Oath. I think most of you have experienced your own white coat ceremony now, and so the trend has caught on. Throughout the 20th century, white coats become more prominent in our uniform, but then moving into the 21st century, there seems to be a changing in the tide, with fewer and fewer people wearing the white coat, with now kind of many of your responses indicating that has kind of fully transitioned. And reasons for that are numerous, as people have already suggested. Yeah. Any questions about the white coat before I move on? Yeah. To your question, Lily, do people still commission paintings for their mentor's retirement? I have no idea, but I love the idea. Yes. Maybe now it's like making emojis in their honor or something. I don't know. The 21st generation equivalent. All right. We're going to switch gears a little bit. We're going to dive into some of the data. The image you see here is taken from a study published in the British Medical Journal Open back in 2018. The study was a cross-sectional study with over 4,000 patients at 10 different unspecified academic medical centers across the country, where patients were surveyed on their preference for physician attire, as you can see kind of done here. And using these images, patients were asked to rate a hypothetical physician's knowledge, trustworthiness, caringness, approachability, and comfort, while asking several other questions aimed at understanding how patients prefer their physicians to dress. So while the academic medical centers were unspecified, I assume some hospital in Seattle was included because both Dr. Cabrera and Dr. Berger were listed as collaborators, but I haven't spoken to them to actually figure out which. They did recruit patients from both outpatient and inpatient encounters. And notable findings were that there was no statistically significant difference for physician approachability when it came to physicians in either white coats plus formal attire, white coats plus scrubs, or just formal attire. There certainly was a statistically significant difference for physician knowledge, trustworthiness, caringness, and comfort, with a preference for formal attire plus white coat. Here you can see a representation of a question of, what would you prefer a physician you're to see in the hospital wearing? And you can see kind of, if you're to add up all the white coat categories, this is 77% of patients would prefer to see a provider in a white coat. And similarly, when you go to your PCP, the number becomes 70%, which is kind of astounding given the fact that certainly 70% or even anywhere close to that are wearing white coats. But I think there are some concerns with this study in the sense that, I think physicians are more dimensional than just an image on a survey. We come with personalities, we come with empathy, we come with caring for the patient, and I think if you could just reduce somebody to an image of them, you certainly may get some of these underlying biases coming out, and so we need to think about that. The other issue with this is that I'm not exactly sure which academic centers these are. There's certainly a large difference in patient populations between the VA and UWMC and Harborview, and so it doesn't actually specify what kind of academic centers patients were recruited from. So yeah. The next study we have is a systematic review. This is published a few years earlier, still in the British Medical Journal. And this systematic review included studies from abroad and also here in the US, places like Saudi Arabia, Japan, England, Belgium, to name a few. This systematic review did include a few studies where it actually embodies the independent variable, and that the physician would alternate kind of wearing a white coat or not wearing a white coat, either every other day or after a few weeks, and then actually surveying patients. And there was a study in Massachusetts that did just this and found no difference, no statistically significant difference in patient satisfaction based on attire. And when looking at kind of all of the studies in the world where there is some clinical component, 9 of 12 studies of patients surveyed after this encounter showed no kind of statistical significance. And so it really does raise the question of, if we only have an image, that maybe that matters, but if you're actually, in the clinic, in the hospital, maybe that kind of is much further in the background and is not as important. That being said, it did include a number of survey, and many of those surveys kind of similarly show, people do, if all they're shown is a survey or an image, they do prefer a white coat. And there probably is a trend that older patients prefer the white coat more strongly, or formal attire more strongly. But that was again seen. And so, yeah. Lastly, I can't finish the data section without at least mentioning some of the data with concern for infection. A systematic review published in Infection Control and Hospital Epidemiology included 8 studies on the white coat and found that white coats, when cultured, had a range of the studies themselves had a range from 0 to 16% of white coats were contaminated with MRSA, and 0 to 42% were contaminated with GNRs, which is a scary statistic to say the least. That being said, there's been no data or no evidence to say that white coats are actually causing or spreading infections. But who knows? Maybe we just don't have the data, and eventually we'll be tracking WCA UTIs, or white coat associated UTIs and white coat associated pneumonias. I'm not sure. Regardless of this, there's been a big push, at least in the abroad, for the bare below elbows movement. And I think that has not taken as much traction here in the US. Yeah. Alrighty. Lastly, switching gears again. So I ended up surveying a number of our own providers, some of whom you probably recognize their names or have met. And I'm wondering, Alan, if you could actually post the document. That'd be lovely.
Like download the upload the document or the website.
The document, yeah.
Cool.
And so Alan hopefully can paste in the document with like full thoughts. But providers had a number of different reasons for wearing or not wearing, and some of them kind of fell along all the same lines. So looking at identity, many folks are kind of mistaken for being a nurse or for being the phlebotomist, and the white coat helping folks recognize that I am in fact a physician, and that's why I'm going to be wearing it in this situation. That being said, Ryan Abe mentions that the white coat doesn't actually protect her from patients assuming that she's anything except the physician. So why bother with fomite and dry cleaning?
And it should be posted, Ben. Sorry to interrupt.
Okay, thank you. Also, can think about hygiene. Some of our VA providers talking about needing to clean the white coat, and if not, then being concerned about infecting patients. And Dr. Nakamoto, one of our sports med physicians, talks about the white coat being dirty having value, and kind of giving him that component of I'm here at work, and I'm taking off the white coat. I'm leaving the grime of work at clinic or in the hospital, and not bringing it home with me. Is a lot of folks had mentioned this in the chat, but pockets become a big thing, and maybe used to be a bigger thing, but still you see folks falling on different sides of this equation, with Anna Golub saying like she needed it for the pockets, and John Cho saying things are just falling out of my pocket, so why wear it? I think folks had mentioned how it's really hot, and I don't know that anybody's got ballpoint pens, but that's Greg Nakamoto's issue with with not wearing it. There's a theme of hierarchy, with folks thinking about the patient provider dyad and how this garment actually distances ourselves from patients. and there's also kind of the interdisciplinary hierarchy of thinking about myself with other team members, RNs, MAs, and thinking about how I can, show a unified front, going back to, Mac's comments of, we want to all be on the same level. We'll all wear the same uniform. I think there's totally reasons to think about it from that perspective as well. And then lastly, a number of folks just talked about the aesthetic of the white coat. I think Becca Ellis really put this nicely, saying, I haven't worn my white coat much. I wore it for a few times in intern year, but honestly, it was too big for me. It just didn't fit right, literally and figuratively, I suppose. And then certainly there's issues in that not too long ago, our residency was only offering white coats with men's sizes, and certainly there's large issues there. Yeah. Wondering if we could move into discussion groups with the following questions. And I will put them into the chat so everybody has them. And yeah, take this wherever your group decides to go. If one question is more interesting than others, I'd be happy to have you just spend time on that one question. Yeah.
All right, are we ready for breakouts? You're gonna have 8 minutes. Okay, there's a timer set.
That's awesome. Yeah, I hope the yelling was fun and exciting, and not that there were tears at the end. All that is to say that yeah, I think it's important to think about what we're doing and why we're doing it. And I think there are great reasons for each individual to make their own decision about this. I will quickly share that I have not been wearing my white coat until one day in preparation for this talk at my clinic, and I can say that I felt really no difference whatsoever. It's like turning 29 or 31 and people asking you how you feel to be that age. It's like no difference whatsoever. But totally could experiment and see if you hear, if you experience anything else. I know we're running out of time. The only other thing I have is, Alan, if you could share the link, but maybe as we're taking a break, there is a PowerPoint with a number of slides where you could put your name, your title, and a little snippet about whether or not you wear a white coat and why or why not, and maybe interesting to read other folks' thoughts on this, or at least I've really enjoyed reading everyone's thoughts who've sent it from the faculty perspective. Lots of great ideas. Yeah, thank you.
Awesome. Thanks so much, Will. We'll take an 8-minute break and reconvene at 9:55.